Hi, everyone. My name is Felicia Elmore. I serve as the Director of Crisis Management at Inner Peace Social Services. Today, I will be discussing the Crisis Response Plan. This plan is specifically designed for the event of a terrorist emergency. Our primary goal is to focus on strategic planning and ensure we have effective response strategies to support individuals who may be impacted by such an event, including our client, staff, and community. Although we have not experienced a terrorist attack at our organization, it's crucial that we remain for the possibility in the future. Mental health organizations have been considered soft targets, which is why it's so vital that we stay proactive in our approach. Today, I will guide you through the steps of this plan, detailing how we will respond in the event of a terrorist incident. This plan is designed to ensure that we are not only prepared to respond effectively, but also equipped to provide essential support to those affected. Now, let's look at the word terrorism. Now, as we define terrorism, terrorism is refers to a violent criminal act committed by individuals or groups driven by ideological goals, which may stem from political, religious, and social, racial, or environmental influences, either domestically or internationally. These acts can include bombings, shootings, hijackings, cyber attacks, among others. The intent is often to disrupt societal functions, force political or social change, or provoke a response that aligns with the perpetrator's objectives. Since 2001, the frequency of terrorist attacks has increased and the threat landscape has expanded and remains persistent. Now, I've created five organizational goals for safety protocols in response of a terrorist incident. Number one, enhance preparedness and response capabilities. This involves developing a clear, actionable emergency response plan, conducting regular training drills, ensuring that all staff members are ready to respond quickly and efficiently. Number two, prioritizing mental health support for affected individuals. This means providing immediate, accessible, trauma informed care for clients, staff, and the community, helping them recover emotionally and psychologically from any potential event. Number three, fostering a safe environment for all stakeholders. This will be achieved through stronger security protocols, improved communication, and safety measures at our facilities. Number four, establish clear communication and coordination systems. This includes having a plan for both internal and external communication to keep everyone informed. And last, number five, strengthening community engagement and collaboration. By forming stronger partnerships with local authorities, first responders, medical hospitals, community organizations, we can ensure that our response is unified, coordinated, as effective as possible. Now we are going to review our crisis response plan. This plan outlines Interpeace's approach to emergencies, specifically terrorist attacks, providing guidance for emergency management and an overview of our strategies across the five mission areas. And those include planning, preparedness, mitigation, recovery, and response. We will also discuss key partnerships and focus on ensuring the safety of both clients and staff members. Additionally, we will this plan will detail emergency response organizations and assigns responsibility for various emergency tasks. While some terrorist incidents may offer warnings or allow for increased readiness, we recognize that many occur without warning. And our response plan is designed to address both scenarios efficiently. Now, when it comes to the planning phase, we will coordinate and execute defensive anti terrorist activities, including criminal intelligence gatherings, investigations, facility protection, and public awareness initiatives. Additionally, we will coordinate and implement offensive counterterrorism operations aimed at neutralizing terrorist activities. We will also conduct a consequence operation following a terrorist incident to save lives and protect both public and private property. We will also ensure that the appropriate notifications of a terror incidents are made to the state and federal authorities. Preparedness phase. In this phase, the CEO will define the objectives and priorities of the emergency crisis plan, as well as provide updates and oversee the execution of this plan. We will ensure clear communication with staff members, clients, and the community, and engage again with our federal, state, and local officials, and request assistance from community partners if necessary. The Director of Crisis Response will oversee daily crisis operations, assess emergencies, assess a terrorist incident, and implement emergency and crisis plans. We will manage resources such as personnel, equipment, and facilities, assigning tasks to a crisis response team. Additionally, the Director of Crisis Response will organize a regular emergency drills for terrorist incidents, activate the Emergency Coordination Center, maintain resource inventories, and act as the liaison to private agencies, volunteer groups, support groups, and other response partners. Mitigation. In this phase, we're going to focus on enhancing security, preparedness, response efforts to ensure staff, client, and community safety. We will look at key measures that include risk assessment, facility security upgrades, and staff training on active threats. We will also provide emergency communication systems, law enforcement partnerships, and crisis response protocols that will be enforced to manage threats effectively. In case of an attack, the agency here will implement a rapid response strategy, including lockdowns, evacuation plans, and cyber threat protections. Post post terrorist incident, trauma informed counseling, business plans will support recovery efforts, ensuring long term resilience and stability. By implementing these mitigation strategies, Inner Peace Social Services will be better prepared to protect our staff, our clients, and the community. This proactive approach ensures that our organization remains resilient and capable of providing essential mental health services, even in a time of crisis. Now, as we explore the recovery phase involves several steps to ensure the safety and well being of our staff and clients as well. First, the facility will assess immediate safety and damage by ensuring the area is secure before re entering and working with emergency responders to clear the space. Once we're safe, immediate mental health support should be provided through crisis counseling, as well as we will provide trauma informed care interventions with referrals made to long term support as needed. Also, too, we will restore facility operations by gradually reopening based on safety assessments and communicating updates to staff and clients. We will also provide emotional recovery, which is supported through debriefing sessions, wellness programs, and self care strategies. We will also make sure we strengthen our community partners with local organizations, law enforcement, emergency management programs that will help secure resources for continued support if needed. Finally, we will conduct an after action review that allow our organization to identify areas of improvement, update protocols, update policies, provide staff training to ensure preparedness for future terrorist incidents. Now, with our response phase, Inner Peace will respond to a terrorist incident with urgency and precision, focusing on resolving the situation by minimizing casualties and proper damage. We will also include coordination with emergency medical services, firefighters, law enforcement, evacuation teams, emergency program teams, as well as providing emergency public information, search and rescue if needed, and other necessary functions. Also, too, we will secure the safety of our clients and our staff and our visitors and community through either evacuation or faculty facility lockdown, depending on our situation. Emergency protocols will be effective and be in place with some staff members assigned to roles such as assisting with evacuation and supporting vulnerable individuals. Coordination with law enforcement, firefighters, emergency medical teams will also ensure the area is secure and threats are assessed. Following an incident, mental health professionals will provide immediate crisis intervention, psychological first aid to address the emotional impact, ensuring trauma informed care is in place at the facility. Communication will remain consistent with regular updates for our clients and staff and stakeholders. Temporary safe spaces will be established for those that are in need and affected. Follow up care will be provided, including counseling and support groups. Collaboration and community partners and local authorities will um, be allowed to continue to address both short-term and long-term recovery needs with the response plan regularly reviewed and updated for preparedness and future emergencies. Now, when we look at our partnerships, we value our partnerships. Establishing partnerships is essential for a well-coordinated response to terrorist events. While external assistance may be needed, we recognize here at Inner Peace that we must be prepared to manage the initial emergency response independently, as outside help may take time to arrive. Emergency responders will typically be first on the site and will take control of the situation until it's resolved, and others with legal authority assumes responsibility as well. They will also consult with officials on the local, state, and federal level, and consult with industry experts if needed. We will continue to foster relationships with local agencies and businesses to ensure effective collaboration is being done during and after the terrorist incident. If Inner Peace cannot provide the necessary services, we will reach out to local partners for support. In extreme cases, the mayor may request the governor to intervene and issue an emergency declaration to manage the situation. Volunteer and support services from nonprofit, faith based organizations, and community organizations will play a vital role in the recovery efforts if needed. And local emergency responders, support groups, volunteer groups, industry partners, county emergency management personnel, community based organizations, faith based organizations will also meet quarterly to discuss any changes, updates to the policies and protocols that we have been implemented after the terrorist incident. Now, to ensure our client safety, we will develop an evacuation plan for our clients to follow in case of a terrorist incident. Staff members will be assigned to take charge in securing those clients and making sure that they are go into evacuation. Our local authorities will arrive and they will take charge in the scene to make sure everyone is safe. We will also work with medical hospitals to make sure clients are transported in a timely manner if they need additional support, as well as mental health hospitals. Now, to ensure our staff and personnel safety, we will establish evacuation plan for our staff members in case of an incident. We will also meet with those members that are assigned to the crisis response team, as well as those staff members that have a certain task or a certain job to instruct our staff members for evacuation. We will meet with them monthly. We will organize required resources such as personnel, equipment, and facilities and assign tasks to the crisis response team. Our CEO will be responsible for establishing and providing communication and updates to make sure that our crisis plan is executed effectively. Our director of crisis response will serve as a day-to-day liaison assessing crisis and emergencies with organizations. They will implement emergency and crisis plan and make sure that the evacuation is ran smoothly in case of an incident. And also, too, the director will also coordinate periodic emergency exercises for terrorist incidents, activating the emergency coordination centers, maintaining resource inventory, and serve as a liaison for private agency, volunteer groups, support groups, in emergency related partnerships. So that concludes our meeting today. Like I mentioned before, we were only going over the crisis response plan. Does anyone have any questions at this time? No? Okay. Well, thank you for taking the time to meet with me, and you have a good day.